Ethanol ablation therapy is a promising new minimally invasive treatment for BPH. What is ethanol ablation therapy for BPH? Pure or absolute ethanol is injected into the prostate at specific sites. Injected ethanol produces cellular lysis. Ethanol causes direct cell lysis through cellular membrane disruption and protein denaturation. Ethanol injection also causes vascular occlusion, which may be another mechanism for its efficacy in causing tissue death. Preliminary studies to date show that ethanol injection not only delivers the symptomatic relief seen in BPH thermal therapies, it has also delivered a measurable reduction in the mass of the prostate. This is accomplished through the targeted ablation and lysis of prostate tissue. The safety of ethanol injection is well documented in other applications and has been used effectively for tissue ablation and nerve blockade over the past several decades. Applications in liver, esophageal, kidney, and gastrointestinal tumors and cancer have been used with great success. Recent clinical experience has shown that ethanol injected into prostate tissue follows a predictable path, is controllable, and creates a clearly demarcated line of tissue necrosis. Preliminary studies show less edema than existing thermal therapies. Injectex patients have typically had their catheters removed within 48 to 72 hours.
What impressed me the most about ethanol is, one, it is commonly used by most physicians. They are comfortable with it. It has a long time history of nerve blockade utilization. It has a range, which is probably the most important factor. A very, very small, minimally inflammatory zone is present, and then perfectly normal tissue is present. By keeping the inflammatory zone to an absolute minimum, which the thermal therapies cannot do, you've reduced the amount of inflammation postoperatively, and you've also reduced the side effects and discomfort the patient experiences.
The Injectex injection device is a revolutionary new product used to inject ethanol directly into the prostate. This device allows ethanol injection transurethral into the prostate, thus avoiding the transperineal route used in the past. The single-use device is specifically designed for submucosal needle placement at multiple prostate injection sites. The Injectex device consists of a handle, thumb ring, detents with auditory report and tactile feedback, ethanol port, body stem, and a hollow core nitinol needle. All that is needed to perform the procedure is a standard cysto setup and 98% ethanol in a 5 milliliter syringe with lure lock. The procedure may be performed under local anesthesia with IV sedation. Begin by inserting the cystoscope into the patient. When selecting your plane of injection, stay at least 1/2 centimeter distal from the bladder neck and clearly proximal to the verumontanum. Identify the urethral landmarks and locate 3, 6, and 9 o'clock positions in the prostate. Starting with the first injection site, insert the needle to the desired depth. Use the markings on the device's handle as reference. While positioning the needle tip, ensure that a safety margin of 1 centimeter from the prostatic capsule is observed. Using direct vision, inject up to 5 cc's of ethanol per site in each lateral lobe. Inject up to 3 cc's per site in the median lobe as necessary. Leave the needle in place for a minimum of 15 seconds at each injection site to allow for adequate diffusion of the ethanol. Slowly withdraw the needle from the prostatic lobe. During any injection, if backflow occurs before the target volume is reached, stop injecting.
With the development of the Injects device, what we were able to accomplish is to make a needle that any surgeon who places the scope at the via montana will be able to deploy the needle, place it 1.5 centimeters in front of them, 1.5 centimeters lateral to the tip of the scope, allowing direct placement into the lateral lobes at the 3 and 9 o'clock position. Only the Injects device has that capability. Most of the straight needle techniques will tangentially approach the prostate, and because of their design and backflow of alcohol by nature, will irritate the endothelium, as has been shown by other researchers.
During the procedure, do not inject more than 2 sites per lobe, and do not inject more than 26 cc's per patient.
One of the beauties of the Injex device is that if you're putting too much pressure on the syringe, you may see alcohol backflowing around the needle. It's critical that a low pressure, slow time release of the alcohol be utilized. What you will see is a blanching of some of the lateral lobes, giving an indication that tissue destruction has taken place. And that's available immediately, that visualization. We've developed a little bit of a collar that gives good occlusion at the interface of endothelium and the Injectex needle. Ethanol is readily visualized as it refluxes around the needle if too much pressure is applied.
Irrigate the urethra and bladder thoroughly during the procedure. Continue irrigation through the end of the procedure and insert a Foley catheter. Typically, the catheter is left in place for 48 to 72 hours following the procedure. To reduce the risk of urinary tract infection following the procedure, 1 week of prophylactic antibiotic therapy is recommended. Anti-inflammatory and/or anticholinergic therapy may also be appropriate in the acute period following the procedure.
Well, from my point of view, the most important thing is safety. I mean, it's very nice to help patients. It's very bad to hurt patients. And I would rather not hurt somebody and not help them. Patients are usually back to work within a week and are pain-free the entire time. I mean, this is an incredible breakthrough compared to what we've dealt with in the past and the stories we've been told about other therapies that were supposed to be breakthrough. The hematuria usually subsides within 24 hours. The Foley catheter has been removed at 48 to 72 hours with an office visit 6 hours after that removal. One of the biggest concerns people had was what the serum alcohol level would be after an Injex procedure. And considering that the maximum alcohol injected is only 25 cc's and it's going into tissue, you wouldn't think there would be a high alcohol level in the bloodstream, and in fact no alcohol levels have been determined. We've discontinued doing that in the immediate post-operative period. Well, contrary to what Shakespeare said about alcohol bringing on the desire and removing the ability, we haven't seen any problems with sex in people that were sexually active before the procedure.
As you've seen, ethanol ablation is a promising new therapy for the treatment of BPH. The Injectex procedure can be performed in about 10 minutes, which makes it cost-effective and minimally invasive for your patients. Additional studies will further evaluate the benefit of this treatment in symptomatic benign prostatic hyperplasia.
The patients are benefiting dramatically more than I initially expected when we started the studies. This will probably be a very big part of treatment in outlet obstruction for patients.